Hello, I'm Dr. Gnewikow. I'm the founder and chief audiologist for Audiology Hearing Aid Associates of Danville and Lynchburg, Virginia. This video is one of a multi-part series that we have designed to answer some of the most frequently asked questions about hearing aids and hearing loss. Today's question: why do some people say, I tried a hearing aid and it didn't seem to help? Or, my uncle tried a hearing aid one time and he squealed in his ear, it was uncomfortable, he didn't seem to hear better. Why didn't it work? Do hearing aids not work? How often have you heard this comment? Now certainly there have been some individuals for which it was true. But why were these folks unsuccessful? Well, there are a number of reasons for lack of hearing aid acceptance. But there are also a number of remedies to those problems that will make a hearing aid work quite well and can literally change your life. Sometimes people in the past have used hearing aids that were improperly fit or improperly programmed for their particular loss. And that resulted in both a lack of comfort as well as a lack of noticeable benefit. And then sometimes you've got people who were not adequately instructed in the proper use of the hearing aid or the expectations during the first several weeks of its use. And sometimes the hearing aid chosen just may not have been the most appropriate choice for the hearing loss. You know, there are a wide range of styles and technologies in hearing aids that must be matched to the patient's particular needs to offer optimal results. Sometimes hearing aids have not been worn consistently enough to allow the brain to adapt to sounds it hasn't experienced in a while. The central nervous system needs sufficient time to readapt to what seems new and different. For some individuals, this may take several weeks of regular usage. In order for a hearing aid to work well and be effective, number one, the prescription or the programming has to be accurate. In our clinic, we use what are called probe measures, which allows us to more accurately assess the amount of sound in the ear canal at the level of the eardrum when programming a hearing aid. Many clinics don't use that technique, but it's actually the standard of practice. Secondly, it's very important to adequately instruct the patient as to how to use the hearing aid in different listening environments, in noise and in quiet, on the telephone. And if they don't have that instruction, then it's very likely that they won't do as well. And thirdly, it really does take some time for the brain to become acclimated and accustomed to a new acoustic pattern. The medical community is very aware of the tremendous benefit of amplification. Otherwise, hearing aids would not be available in all the major medical schools across the country. The fact is, amplification works quite well when properly fit by an experienced audiologist. I hope this has been helpful, and thanks for listening.